Medicare enrollment periods, there are many and they can be confusing. And if you miss your enrollment periods, you could end up paying late enrollment penalties. Millions of people pay Medicare penalties every year due to missed enrollment periods. That doesn't need to happen to you. In this video, I'll walk you through Medicare enrollment periods starting from when you're first eligible for Medicare, through all the enrollment periods that come up once you're on Medicare, so you can be prepared for what's coming and know your rights regarding enrollment in Medicare and Medicare plans. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new, helpful Medicare content every week. In chronological order, as much as humanly possible, here are the Medicare enrollment periods. Initial Enrollment Period. The Initial Enrollment Period, or IEP, is a 7-month window around the month in which you turn 65. For most people, the IEP starts 3 months before your birth month and ends 3 months after your birth month. There is an exception. If your birthday is the first day of the month, your Medicare coverage will start the month before your birth month. And that moves your initial enrollment period too. Here are a couple examples. If your birthday is April 20th, your IEP starts on January 1st and runs through July 31st. If your birthday is February 1st, your IEP starts October 1st and lasts through April 30th. What can you do during your initial enrollment period? You can enroll in Medicare Parts A and B. With very few exceptions, most people should enroll in Medicare Part A when they become eligible. Medicare Part B is a different story. The video linked above explains whether you should consider delaying your Part B enrollment if you are going to continue working and have group employer health coverage. Your group health plan will be able to tell you whether you can safely delay your Medicare Part B enrollment without penalty and whether your group health coverage is considered creditable coverage by Medicare. Those two things are very important to learn before you turn 65. If your group coverage is creditable coverage, you won't have to worry about late enrollment penalties from Medicare later. If you apply for Medicare Part A and or Part B during your IEP before the first day of your birth month, your Medicare coverage will be effective on the first day of your birth month. First day of the month, birthday people, of which I am one, remember this is all pushed forward a month for you. I'm not going to give that disclaimer with every example for the sake of time. So if you are like me and were born on the first day of the month, just keep in mind that all of this gets slightly shifted for us. Now, unless you have a good reason, don't delay your Medicare Part A and possibly Medicare Part B enrollment. Medicare punishes people who enroll later in their initial enrollment period. If you wait to enroll until the month when you turn 65, your coverage will start on the first day of the next month. If you apply 1 month after you turn 65, your coverage will start 2 months after you apply. And if you wait until 2 or 3 months after your birth month to apply, your coverage will start 3 months after you sign up. Also during your IEP, you can enroll in a Medicare Advantage plan or a Medicare Supplement and a standalone Medicare Part D plan. You can't enroll in all of these plans together. In most cases, you will choose either a Medicare Advantage plan that includes Part D drug coverage or a Medigap, also known as Medicare Supplement plan, plus a standalone Part D prescription drug plan. Medicare Advantage and Part D plans have the same enrollment windows. If you apply up to 3 months before your Medicare effective date, your Medicare Advantage or Part D plan will start on the first day of your birth month. If you wait until the month of your birth or later, your Medicare Advantage or Part D coverage will start in accordance with your Medicare coverage effective date. Medigap or Medicare Supplement plans have different rules. You can apply for a Medigap plan up to 6 months before you are eligible for Medicare. In that case, the Medigap coverage will be effective the first day that your Medicare Parts A and B coverage are also effective. Medicare supplements also have a different window after your Medicare coverage is effective. The first 6 months that you are both age 65 or older and enrolled in Medicare Part B is known as your Medicare Supplement Open Enrollment Period. This is a one-time enrollment period that is only used for purchasing Medigap plans. During this period, you can purchase any Medicare supplement sold in your state without having to answer any health questions. And you can't be charged a higher rate by the insurance company. For instance, during this enrollment period, tobacco users qualify for non-smoking Medigap rates. And the Medigap company can't impose any pre-existing condition delays in coverage. If you miss your initial enrollment period, your next chance to sign up for Medicare Parts A and B is during the general enrollment period. This runs every year from January 1st through March 31st, and your coverage is effective July 1st. If you went without creditable coverage from another source, enrolling during the general enrollment period will add late enrollment penalties for Medicare Part B and Medicare Part D. The Part B late enrollment penalty is an additional 10% of the Part B premium added to what you pay every month for each 12-month period that you could have been enrolled in Part B but were not. In 2022, if you delay coverage by 12 months, that means you'll owe an extra $17.01 every month on top of the $170.10 Part B monthly premium. The Medicare Part D late enrollment penalty is explained in the video linked above. That one can also really add up if you go without Part D coverage. If you enroll in Medicare Parts A and B during the general enrollment period, you will be able to use your Medicare Supplement Open Enrollment Period, which runs the first 6 months that you are on Medicare Part B. During the 3 months before your Medicare coverage becomes effective on July 1st, you do also have the right to enroll in a Medicare Advantage plan or a standalone Medicare Part D plan. All plan coverage will be effective July 1st. For Part D coverage, whether in a Medicare Advantage plan or a standalone Part D plan, you will have a late enrollment penalty added to your premium every month if you did not have other creditable coverage. Next, we have the annual enrollment period. Between October 15th and December 7th every year, you can change your Medicare Advantage or Part D plans. Any changes made during the AEP will be effective January 1st. The AEP can be complicated, so the video linked above explains what changes you can and can't make during that enrollment period. Next up is the Medicare Advantage Open Enrollment Period. This is an annual period that runs from January 1st through March 31st and is only for people who are already enrolled in a Medicare Advantage plan. During this time, you can switch Medicare Advantage plans or leave your Medicare Advantage plan and return to original Medicare. If you do that, you have the right to purchase a standalone Part D prescription drug plan. However, you may not have a guaranteed issue right to purchase a Medicare supplement. State laws vary, but you will want to look into your Medicare supplement options before disenrolling from your Medicare Advantage plan. Those are all of the regular enrollment periods. There are also special enrollment periods. You qualify for these based on changes in your life. If you leave your employer's group health coverage, move to a new address, become eligible for Medicaid, or lose Medicaid eligibility, lose your current coverage through no fault of your own, and so on, you may qualify for a special enrollment period. Special enrollment periods give you at least 2 months, and sometimes longer, to make enrollment changes in Medicare itself and Medicare plans. There's a lot of variation in special enrollment periods depending on what your situation is. There's a link in the description that explains the most common special enrollment periods. But if you have questions not answered by that link, give us a call. and we can help you sort out which special enrollment periods you may qualify for. Special enrollment periods can be triggered anytime during the calendar year because they are based on changes in your life, not a set schedule. All of the enrollment periods can be confusing, but you don't have to keep track of them alone. We are here to help you work through Medicare confusion to make sure you don't miss any enrollment periods and don't end up owing any late enrollment penalties. If you have questions or would like advice about your specific situation, feel free to give us a call at 877-312-1414 or visit bcmwi.com. Have a great day.